By now, you may have heard the new term flu-rona. It refers to someone who's infected with COVID-19 at the same time as the flu.
Pediatricians say nationwide about 80% of children hospitalized with COVID are also infected with another illness. KVUE's Darren Shaharan spoke with the chief medical officer at Dell Children's Medical Center about the co-infections that local kids are dealing with.
During this surge, pediatricians are seeing an unusual trend.
Very rarely you have 2 or 3 illnesses happening at the same time.
Nationally and here in Austin, more children are in the hospital with COVID and a typical winter virus like the flu.
But they're not having just COVID, they have RSV, they have human metapneumovirus, they have rhinovirus, they have any of these other infections along with COVID.
Dr. Mina Iyer is the chief medical officer at Dell Children's Medical Center. She says last week, about 40% of their COVID patients were co-infections. This week, it dropped to about 10 to 15%, but it's still a concern.
It does make them sicker, and then it takes longer for them to recover, right? Because you have 2 or 3 viruses attacking you at the same time.
She says most of their children with COVID are admitted for something else, and thankfully, they haven't seen any child deaths from COVID, but more kids are getting sick.
The variant is more contagious. But it causes more of infection in the upper airways.
That's in line with what we're seeing statewide. 397 children are in hospitals with COVID, just shy from the record set on Friday, when 400 kids were in hospitals. Dr. Iyer recommends getting your child vaccinated for COVID and the flu as well. 1, to keep symptoms mild if they are infected, and 2, to keep them in class.
They still need that working with each other and avoiding social isolation, because that has caused such a huge mental stress on our kids, leading to suicidal ideations and depression.
In Austin, I'm Darren Shaharan.
Pediatricians also say the COVID and flu vaccines don't impact each other's effectiveness, and it's safe for kids to get both shots at the same time.